Hi everybody, Dr. Bryton here for Two Tip Tuesday. This week we're actually responding to a patient request. We're going to be going through essentially my personal oral health toolkit. What do I use at home that helps me prevent and also protect and be proactive in helping my oral health? So without further ado, we'll get into it. So I got my nifty little toolkit over here. First thing first, toothbrush. Now in particular, I do recommend an electric toothbrush. Electric toothbrushes are way more effective at removing plaque off your teeth and keeping your mouth good and healthy. In particular, I recommend the Philips Sonicare Diamond Clean brand. The reason being, it's a pulsating brush. So there's the Oral-B spin brush. It's probably one of the more advertised brushes. Still does a good job, but it's been well proven that the pulsating actually does a much better job at removing plaque off your teeth. I used both. I chose the Diamond Clean with the pulsating. I used the Oral-B for probably over 5 years and switched over to the Diamond Clean personally because it does such a better job. I can literally feel the difference, and then you can see the difference during exams and so on and so forth. So Philips Sonicare Diamond Clean pulsating to remove plaque off your teeth. From there, I've got my fluorinated toothpaste. I use cavity protection. I tell patients be mindful. Like the whitening toothpaste, they do have fluoride in them, but the whitening portion of it can actually be somewhat of abrasive to your teeth, so it can actually beat on your teeth a little bit. So I'm not a huge advocate for those. If you want to use them sparingly, sure, go ahead, but it can actually wear out the teeth a little bit, make them even sensitive. But so cavity protection, so wipe off, get the plaque off, pulsate it off, then from there, get fluoride on it to help strengthen the teeth. From there, I get into string floss. Daily, daily, daily. Remind you, if you're brushing your teeth twice a day, that's awesome, but you're missing 2 of the 5 surfaces on a tooth. You got to floss to get to those. And I recommend just waxed floss, string floss. It's the gold standard, getting plaque off of the spaces between your teeth, getting the junk off of your teeth between your teeth. If you have trouble with floss because your fingers, dexterity, manipulating it where it needs to go, because you do need to do it right, you need to have what's called the seat technique, where you wrap around the tooth, which we've gone over in some of these Two Tip Tuesday videos, then I recommend a Sonicare or Philips Sonicare air flosser. Similar if you've seen like water pick commercials, those are a little more advertised, but this is a lot lower profile. It's easier to use, easier to travel with too. The water pick usually has like a jug associated with it. They do about the same job. This is just easier, and so this is the one that I recommend. From there, I got my bite splint. I literally can't sleep without this thing. If I do, like for instance, last night I fell asleep watching a movie. I was up way too late, and I woke up and my teeth hurt. Well, I didn't have my bite splint in. And so bite splint, it's incredibly useful for all kinds of reasons. Protects your teeth from wear and tear, protects the structures that support your teeth, i.e. the jawbone and then the gums that lie over top of them, from deterioration. If you rock that tooth back and forth with clenching and or grinding, you're going to deteriorate that support system. That makes your teeth over time more prone to problems, also increases your odds of developing gum disease. You deteriorate that jawbone around there, it's more susceptible, it's more vulnerable to bacteria getting in and setting in, causing gum disease. So my bite splint. From there, very rarely will you ever find me without a pack of sugar-free Trident chewing gum. Has xylitol in it, which helps to fight the bacteria that cause cavities. In general, it also helps if you eat it after a meal or a snack, remove the debris off of your teeth. By chewing it, it literally pushes it off, cleans off the teeth a little bit. So if I can't get to a toothbrush, can't get to mouth rinse, can't get to floss, chewing gum is a great alternative. I use this all the time, just for a couple minutes after a snack or a meal, but I have this on me almost all the time. From there, some xylitol-based candies. Sugar-free, it's got xylitol in it though. So you get a nice tasting candy that also fights cavities. You really can't beat that. So these are, in particular, the ones we have are Dr. John's. If you're ever interested in these and you want to know how to order them, call us. And then last but not least, my reserve visit. So making it to all of my personally recommended cleanings on time. All of my prophylactic appointments, and making sure that I'm having my teeth professionally taken care of. I can do so much at home. I can only do so little, so much though. And then from there, the little that I do does need to be complemented by a professional. And that's where we have Lisa, Nikki, or Jillian that do a wonderful job. So that's my little toolkit. Hopefully you find that helpful. If you have questions, please reach out, make a comment. I love that people are starting to comment on these because people are learning just by the Q&A that we're able to do on it. So please do more of that. I really appreciate it. And those of you that have submitted questions via email or come in and asked some things, hopefully these are helpful for you. We're trying to get to them all, but do that more of you. If you want us to talk about certain topics, please request it. So hopefully you have a great rest of your week. We just really appreciate you tuning in. Like this, share this. It's there to help people. So have a great rest of your week. Thank you so much. Hi everybody, Dr. Bryton here again for Tooth Tip Tuesday Part 2. As I got home this evening and was getting ready to kind of do my nightly routine, it dawned on me that I completely forgot to mention one of the key tools that I utilize, and that's a mouth rinse. So at home I figured what better, let's get the actual sample of what I use. So this is Listerine Nightly Reset. It's a fluorinated mouth rinse that also has xylitol in it. So again, mentioned earlier in the part 1 video, xylitol is a great cavity killing or bacteria causing cavity killing aspect, and so it has it in the mouth rinse, so I really like that, and then it's fluorinated. In addition to that, we also have ACT in the household. For both of these, 0 alcohol. I do not recommend an alcohol-based mouth rinse. Can dry out the tissues, actually make them more inclined to develop malignant pathologies, so you just want to be careful with that. But here's another one we use in the house. So hopefully that now caps off my toolbox and is helpful for you. But if you have questions, please ask away. We love them, and we just appreciate you tuning in. Have a great rest of your week. Thank you again. Bye.